it easy.
I am.
Take them to the giant.
You got here early.
Yeah, they supposedly be doing 10,000 acres.
Is there any public comment tonight? If none, I'll go ahead and call the meeting to order. We need to approve the agenda, if everybody could take a look at that, because we have a change.
Yeah, the only change we have is that we do have another closed session tonight, citing a personnel matter, and it was suggested that we just flip old business and new business tonight, so that we cover that last and do the closed session after new business. So 4 would become 3, and 3 would become 4, basically.
Any discussion?
I move we accept this thing as written.
As amended. As amended.
Everything's leaving that way.
Second.
You got a second?
So many rules.
All in favor? Any opposed? Motion carries. Thank everybody for coming tonight, and do you have any introductions, departures, or recognitions?
No.
All right, moving along, if you will review the minutes from the last meeting, let's take a look at those, and then we'll try to get those approved.
Motion to approve.
Second? Anybody give a second?
I'll second that.
All in favor?
Aye.
Any opposed? Motion carries. All right, we'll go into new business then. And our first item was Safe Kids.
Excuse me.
Yeah, at the end of the last meeting, Molly Phillips asked if we would add Safe Kids back to the agenda again for discussion. That is open to
Well,
conversation.
really, you really want to talk Safe Kids as much as that I have an interest in seeing the car seat, having a car seat technician within the health department. So that would be more of the discussion I'd rather have open instead of actually the Safe Kids umbrella. So.
I wasn't here last time, but reading through the minutes, do other health departments have somebody that does that?
There are,
Has a technician?
there's at least 6 health departments in the state that have certified technicians in their health department, yes.
So after we talked last time, we went back and there were some questions that we had to get answered, but what I've agreed to do, and I told Jim that I think this is kind of until we can identify somebody, because I've looked at my section to see where I can put somebody in that seat, like the child health person or school nurses or things like that. And right now, I just don't have a place to do that in my section. So what I've agreed to do is, since we have maternal health on Tuesdays, is I'm gonna see if we can get some videos and things like that to play, because that's typically our busy as a day for the pregnant women to be here, and see if we can start putting videos in on car seat safety, things like that, and play them in the waiting room, or play them, you know, so that the people waiting get to see them. And then I want to see if we can get, once Brittany does the car seat training, see if, and the Safe Kids does it, if we can get the list of people who are certified car trainers and make like a list that we can hand out to people for right now until we identify somebody that can do that or has time in their schedule to do that, because I couldn't find anybody to do that.
Well, that sounds great. I actually called around. I know Jackson County, which is probably about the same size staff or smaller staff, would that be right? They have 5 certified technicians, and what they do is they split a day. I mean, during the week, they split one day a week, 5 of them, and they do it by appointment only. So they know in advance about how many people they're going to have, and some days she said we have 0, and some days we have 4. They're looking at training their interpreter, because there is a population of Hispanic folks that, so the interpreter has to go out there. You know, but I know, at least they advertise it, that Cherokee County, Swain County, that all the health departments in the western region have a car seat tech, at least one on their staff. So it just sounds like the size, and it seems like based on their list that they've got less employees than we do.
So if you look at that, how much time? Is it a full-time job? Is it a,
Well, she
like,
said,
I said, a half-a-day-a-week job? How much?
well, it depends. The Jackson County lady said that, you know, one day she'll do 4, and they'll switch. If somebody like you has a certified and you have meetings, then we'll switch, you know, that they have a very good relationship with each other, so they just kind of mix and match. In summer, I think they're not all under the same department, so there's a little bit of flexibility that way. She said in general it takes 30 minutes because they show a 15-minute video. Obviously you don't sit there through that, but they show a 15-minute video, and then it takes about 15 minutes to do the car seat checking.
We did have a conversation in the leadership team about it, and so far there's nobody that stepped forward that says they have staff that have the time in their sections to do it. We would have to add staff to do it. We made a list, Jennifer and I and Kyle and a couple of other folks, of all of the child health things that we're currently doing. And this is the list that we would look at to see where we would stop doing something in order to do the car seat. To do that, we have to ask for additional funding in order to do that process.
Right.
Those other counties that you've talked to probably have funding specific to that program.
Will we get one of the firefighters or one of the people that's trained to come over and possibly?
Volunteers can do it, and we did check into the liability insurance issue. There isn't a liability policy that covers people. Volunteers are covered by a Good Samaritan general statute. Basically, it's similar to Good Samaritan rule. It does not cover us as employed individuals. I talked to the county attorney. We did check with our insurance carrier, and the county is covered if we do the program.
It seems like maybe the need is for Hispanic, so.
Well, we also checked with WIC and the state, and we can't use any programs that have federal funds. You can't use the federal funding for the car seat program. They've already instructed us on that.
How come?
Because they're everything is done by a contract and agreement with the state, and it is not the contract agreement, so they won't let us do it. I mean, that's pretty much it. And we don't get to negotiate those contracts. The state negotiates those with the feds, and the feds then, in turn, give the state the money. And then they dictate to us what we do or don't do with that money.
And we don't even know that it's objecting to doing it, it's just that right now, with the way the schedule is, with everything that we got, we just didn't have a place to put it in.
Well, I guess I would say is that what I would like to see is that a training is coming to locally, so there's no travel, because I think, you know, there would be.
Training is full.
They open 2 more spots.
Yeah.
Those are 2 more spots.
Josh told me it was full when I talked to him the other day.
Yeah. When I met with him on Monday, he said they opened 2 more spots. So maybe those 2 spots already been taken.
That's when I talked to him, was Monday, so.
Well, and that's what I'd like to see, is that it's gonna be here locally, and so there would be no travel involved to get somebody trained, and then at least see if there's no need for it, then, so that person, you know, spent a half a day getting trained or a full day getting trained, for an important piece in child safety puzzle. You know, the statistics are
We don't
pretty
disagree.
astounding on how many kids are
We just don't have the
not.
staff to do it, I mean, that's the
Well, I guess
problem.
that's what I don't understand, is why we don't have the staff when the other counties do it and have less staff. I mean, how many of these programs, I guess, are they doing that?
That would
they're
be a
not
question to
doing?
ask. That, I mean, not every county does the same thing. We don't all do the same functions or programs in our health departments. It depends on the community need and what the desire of the community is. If the desire of the community is for us to have somebody doing car seats, then we need to figure out how to do car seats. This board needs to say, we want you to do car seats.
Okay, okay, so that's what I brought tonight, because that's what I'm saying, is that I feel like there's a need for car seats at the health department, at least at minimum, to get them trained, and while somebody is local and there's no travel time cost involved in that actual procedure. So that's what I would say.
And it's part of the reason that, because we need to hire some more people, and we have to open that department, right?
In my section, we have one opening that's posted, but otherwise we
But
don't
I'm talking
have.
about, and the rest of the health department, are there, if we were fully staffed, would we have somebody who had a couple extra minutes?
Not according to I've told every one of the leadership team members.
Even if they had an extra?
So do you have to have car seats on hand too, in case the car seats expire? Is that another investment that's part of the program?
That's what they said, right?
Only
The
for law
parking-
enforcement officers.
Can you say that again? What did you just say?
If you're a law enforcement officer, because it's against the law to let them drive away without a seat, certified techs don't have that same obligation.
I like the idea of having the video tapes and pre-op clinic and went to, or went to there. I think it'd be very helpful to roll that out so they understood the importance of it.
And part of it would be too, this list that we made up from, based off the trainings that they're having, of the resources would be that we would hand them out during maternal health clinic, and we can hand them out, we can give your office a copy too, and let your office have a copy, so that they can hand them out then too. It's just, I mean, with doing primary care and all the clinics we do, they're just stretched to the maximum back there now.
And the person who does this doesn't have to be a health care professional or anything, it doesn't be anybody who's good for training.
Will the training be done again?
They are, because there's so much of an interest for the first one, we're working with the Western Region office to bring another one here. Because they don't come here ever, so we're working to bring another class here after this one.
Would that be, anticipate that would be?
It's when we can convince Ryan to come back, probably in the fall is what we're looking at, so it'll be a couple months. Hopefully we'll have another one before the end of the year then.
Seems to me that this is late in the game to be pushing the car seats. I think the ideal place for the car seat to be brought up is before the baby goes home in the first place. When our new baby's born, are we gonna get a car seat lecture? We're gonna have anybody check us as we take this little child from the hospital and.
Yeah, but you switch car seats, they go from a newborn seat to being frontward facing to being.
But that's a good place to start, though.
No, I
Yes,
agree.
but that's what the hospital does.
And
They come out and
I
measure the
believe
cars.
that the person who's at the hospital, who brings you from the hospital to your car, checks your car seat
Okay.
before they let you and your wife get into the car. Now, I can't say that 100%, but I know they go down and I hear them say they're gonna do a car seat. I will look into it further, but I don't know that for sure.
Well, that sounds like a really good place to start.
Or maybe they can
And
check and
then-
make sure there is a car seat, I don't know.
Yeah,
No, but I agree, and I think it'd be nice to have those things to roll or to teaching stuff.
Well, you know,
for
we're
our
on the
office as
sit out
well.
in the lobby.
yeah, and you're
I mean,
in the lobby of your office instead of SpongeBob, we could be watching,
yeah.
at least one of the TVs, I know there's several TVs in there.
Well, but the
one of
next
them-
logical question comes from, I watched this video and, oh my gosh, I don't know if that I'm right, can you come check it? And we would have to say, well, no, that's not what the health department does, which, that to me doesn't make sense, that the health department doesn't have anybody that's certified to do that.
to be, I mean, and just in my section, I mean, until we see how things roll. I mean, I just don't know where they would put that. And that means if I pull one nurse out of the clinic to go out to check a car seat, I have one less nurse in the clinic, and I got to pay my.
But what they're saying is that it doesn't have to be a medical person.
Yeah,
It could be
it doesn't
anybody.
have to
It could be Jim, I mean, it could be
Yeah.
anybody that's trained to do it.
It really could be.
You don't get liability, you just told you
Yeah,
that.
there's no liability with it.
But are we liable if a baby crashes in a car and gets killed as
What?
well?
I'm sorry, what did you say, Jim?
Teresa asked me if the question,
I mean,
my answer is if the board wants us to do it, we're gonna do it. I mean, that's the answer.
Yes, I mean, then,
I think at the very least, we should go ahead and get somebody trained and then work on the logistics as time moves forward.
Who are we gonna train?
So I make a
I'm
motion
checking
that
that
we, that we have a representative from the health department, get certified if there's room in the local Safe Kids training. That's my motion.
Second.
all in favor? Aye. Any opposed? That's right, for the budget.
I'm going to give an overview, or I'm going to give an overview of where we are. We actually turned our budget into the county last Friday. The road carried it over there. So this is a 5,000-foot overview of our budget. This year, the county, again, is the most stable funding we have. It's about 47% of our budget for this year. It's $2.5 million is what we're asking in county funding. That's $152,600 less than what we asked for last year. And the reason in our adjusted budget at the end of the year, and the reason that's less is that we're not asking, the county manager has asked us to take a look at our budget and try and find any place that we could find some savings so that they could implement the second and third phase of the salary plan for the county employees. So this year, we've not put any capital projects in our budget, which is vehicles or renovations to the facility. We did not fund the temporary part-time dental assistant position in adult dental, and we've asked for we've asked for a couple of computers, but usually we're in the $20,000 to $30,000 range for computers, and we did not ask for very many computer replacements next year. We did ask for a small contingency for computers in case something dies, so that we can replace it, but we're not replacing a whole year's worth of computers as we have done in the past, a specific year. Projected revenues from all sources right now is about $2.8 million what we're projecting. That's about $150,444 less than last year's adjusted budget. And I'll get into exactly what that is in a minute. Federal pass-through money this year is about 15% of our budget. It's $799,000. State money is 6%, about $319,000. Fees is $1.6 million, about 30%. The majority of that, $1,064,000, comes from Medicaid. The rest comes from other sources, self-pay, private insurance, and those. Grants is 2% of our budget. It's projected to be $91,537. 48,000 of that is Smart Start. 42,500 is one of the things we're requesting this year is to replace the dental clinic's electronic health record, upgrade it, not replace it, but upgrade it. And there is some meaningful use federal money that we may be eligible for. And if we can draw that down, we'll draw that down. And then the Sharing Center grant, which is $300. Projected revenues continued. Major changes include reductions in chronic disease grant. We have that regional 1422 chronic disease grant. We usually get notified of carry forward money before we put our budget in. So last year we got over $400,000. This year we're at the base rate 352 because they have not projected any carry forward money from this year's current year's grant. It may come, but right now there's none, so that's about $118,000 less this year in that grant. Primary care, we had a late start with primary care this year. We didn't get it going until January almost, and it has not picked up at the rate that we thought it was going to pick up. So we've reduced the revenues for primary care for next year, commensurate with that. And in general revenues, just kind of across the board, in the 40 or so revenue lines we have, there's about a $2,200 difference. Not a significant difference in revenues. Total expense budget for the health department projected for next year that we submitted is $5.3 million. That's, as I said, less than last year. We are $303,000 less to be exact, or about 5.3% from what our adjusted budget was for the year, not what our initial budget was last year. Most of that is in programmatic changes, and this is going to sound funny because a minute ago I said we had $303,000 worth of changes, but the actual reductions, when you start going through all of the budgets, comes out to about $422,000. 67,000 of that is salary and fringe, 235,000 of that is operating. The majority of the salary and fringe was due to some of the environmental health retirements we had. We had 2 long-term employees retire, and folks that moved into those positions apparently got paid significantly less. The Navy. In operating costs, again, it's the capital. We had $85,000 in vehicles last year that we're not going to be doing this year. Grants, we had the CDC grant at $118,000. The MCH grant, which is about $20,000, which will be expended before June. We may carry some of that forward into next year, but it depends on whether they allow us to do that or not. And the Ebola money, the same thing. We had $20,000 at the start of the year. We have a little bit of that left, and we're waiting to find out if they'll allow us to carry that forward or not into next year. There were some things in contracted services that changed and were reduced, and again, the computer line went down significantly for this year. In the end, total increases kind of across the board in different programs came out about $119,398. We had a significant change in autopsy fees. We thought it was going to be a couple of $1,000s by the end of the year, but apparently we've had a whole lot more autopsies done this year than we've had done in the past several years. We have actually exceeded our $20,000 limit in that about 3 weeks ago, and we had to ask the county for about $14,000. They first asked us to find that in our budget, and we did. The money that we're going to reduce that dental position by, we just moved over to contracted service or the autopsy fees to cover the autopsy fees for the rest of this year, and that'll be new county money next year. And then we're trying the dental EHR upgrade, and then we're trying to upgrade smartphones for all of the staff, that not all the staff, but the majority of the staff, the school nurses and environmental specialists, and a few other staff, because they need the technology, and they have not had that. Texting on Jennifer's flip phone is a nightmare, she tells me, and that's what she's still using. This slide I just put in there, just kind of an overview for you of what our FY16 adjusted budget was, where we're projected to finish this year, and then what we're asking for and what we requested next year. The only fee changes that we brought up was one that's been brought up here in the board health meeting several times, and we talked about it with the environmental health staff. And right now the environmental health staff has put forth 2 options. One option is not to make any changes at all. And the second one is a request by environmental health staff to eliminate the on-site wastewater and private drinking water well repair fee. And they came to me yesterday and asked if we could add the well abandonment fee to that. It changed our reduction in revenues, which would increase the county costs from $8,000 to $9,000 to about $8,000 to $10,000. Kind of went back over the past several years to look at the numbers of wells and septic systems we've done repairs on, and the number of abandonments and wells. And that's basically our estimation, is that we would be asking the county reduce the environmental health revenue side by $10,000, which means that it'd be about $10,000 more in county cost. We did not factor this into those projections I told you about a minute ago in our budget. We left that the board that needs to make the decision as to whether they want to support that and vote to support that fee change. I did have a conversation with Ms. Murray today, earlier, that if we are going to talk about other environmental health fees, that we put together a small ad hoc committee of board members to have that conversation with environmental health, and then bring that back to the board before the budget is approved in June. The things that we see, the two primary things that environmental health staff thought would be an impact on this change is that people would be more likely to report or fix their well problems or their septic system problems before they become a problem for their neighbor, which then makes it a public health issue. And the other side is the perceived, we don't know if it's for fact, but the perceived increase in workload that might occur by the fact that people would be reporting what they're doing. But these are not, none of these are really super labor intensive. They're probably the easiest things, as Kyle told me, that environmental health does. And so it could have an impact on turnaround time. We have no way to estimate that until we do it. So the only thing that I need board to approve on the budget tonight is this fee change, and whether you want to support that going forward to Derek or not. And that's a change that we'd have to submit to what we've already turned into the county.
What do you think, Kyle?
I think, outside of the larger conversation on fees, I think this is a public health suggestion that I would make. I feel like this would increase.
Let's do it.
So they were, wasn't a repair fee 175?
A septic repair is 125. And I do know of instances where people have done everything they could to not have to pay that fee and not get us on the property and delay to us ultimately doing what we have to do is fix the problem. A well repair is $375. It's the same thing it's the same fee as a new well. One change I would make, wouldn't necessarily be free, is we still would have to charge for the water sampling, because that is required the same.
Is that part of the 375?
Yeah, I would charge $75 just for the water sample. So we normally charge $375. What we end up doing is just charging for the water sample.
And that is an already approved fee. I forgot to say that. Kyle told me that, reminded me of that before we came in here.
So you're about to repair a week.
Water samples included in 375.
Yeah, it's already included in that. We do about 50 septic repairs a year. We do about 8 well repairs a year. And we do about 3.5 well abandonments a year. So that's the kind of workload that we're looking at with these now, but they come up to about $10,000 a year in fees for these. Go ahead.
I was going to ask how much, after they have gotten the repair order, how much are they spending to actually get those repairs accomplished?
It depends. On well repairs, well repair encompasses everything from hydrofracking, get to talk about those again, drilling deeper, or even something as simple as changing the casing around the top of the well, which is very simple. And us, it's probably that work probably costs less than the actual permit fee, for example, doing the well casing. So that range is pretty high. On septics, it can be the range is high too. It can be anywhere from $1,500 for the drain lines. It could be, Paul's probably seen much higher than that. It could be $6,000 to $8,000. Who knows?
Just your sense on then how often it's the cheap?
Usually it's the cheap.
Okay, good. So you're saying that the fee we charge is a significant portion of their whole total bill?
I won't say it's a significant portion. I will say
So lowering it would lower the.
it's an entry fee. It gets us in the door faster. It gets us in the door more often. So whenever we charge fees to go out there and make you fix what's yours, that becomes varied. We have people that come to the window and they just leave. I've had phone conversations with people and I tell them what options are for fixing it, and then I end up having phone conversations with them later because they tried to go a different route instead of paying for us to get out there, and then they're coming back to us again anyways. And by that time, the problem got worse. So,
What we want to do is encourage people to fix the problems the right way, as opposed to sometimes taking it on themselves to try and repair it. And
when there's an issue with something like, we want to be in on that conversation from the beginning.
Yeah.
We're the third party that's only interested in public health.
And so you think that eliminating these fees would actually make a significant difference
I
in
think-
the number of people who actually do this?
Yeah, I think it would get us in the door quicker in most cases, in many cases. And I know in some cases, we don't get in the door at all, and I think this would help us get in the door. And I do know, not that this is the only reason to base a decision, but I don't know if right now of any other counties that do charge for repairs because of the same concept. They want to be involved from the beginning. This is, a public health entity, and so we want to be involved and fix that for protection of healthcare.
We found the money to cover it then.
Well, we're asking.
We're asking for them. If we do this, we would be asking the county for those additional funds.
That's the problem. That's the part I
So-
didn't get.
So how many of these systems do become public health hazards?
Well,
Because they didn't come get a permit to repair.
it's actually hard to say because if they don't get a permit, we may not know what's going on for a long time.
Okay, but for a long time, how many become public health hazard?
Sorry. Let me start.
Anyone that's spilling sewage on the ground that's going beyond the boundaries of where the drain field is going to have an impact on a well or another
Okay, how
stream.
many
Or
annually do we have?
How many repairs?
how many repairs that would have been considered something that had a public health impact?
Well, we've had 50 applications for repairs, and I'd say the majority of those are public health issues.
Yeah, I looked at 2 yesterday for a bank, and one of them has been failing probably for 3 years, and the Latinos live in it, gang of Latinos. And it's puddled in the backyard right where they park their cars,
The kids are playing.
and they dug a ditch to the branch. And
But is that an example, if you give them a free repair permit, they're gonna fix it?
Yeah, they're gonna suddenly come up with $12,000 to fix it when they couldn't come up with $125.
no, it's not, no, it's, I mean, that's a minimal part. Now, the well, absolutely, if you waive, I mean, the well is not a public health hazard. I think the well thing.
A lot of times the well repairs come about as a part of a variance application. We go out, somebody wants to build a garage closer to there, or they have an issue where they have to get a variance for a well. And they're violating setback. Got to get the state to approve it. They'll require a repair permit to bring that well up to new standards. And it may be something as simple as adding a few inches to the casing of the well, which we have to require a permit to do.
And those are your low-cost items. Now, your septic system, like Dr. Lindsay said, they're not, some of them are 12, absolutely. I've seen them much higher than that, but generally, on repair, you don't enforce new code. You make the object, I think, of environmental health is to make it better than it was. You try to get 100% repair up to code, but if you can't, you just want to correct the problem. But those repairs can be in the thousands, $3,000, $4,000, $5,000. So $125, yes, that's insignificant to the overall cost. I think that's catch-22. I mean, once they come in and apply, and the health department goes out there, then they're trapped. They realize that, but.
Yeah, then what if their $4,000 repair turned into a $12,000 repair? I mean,
I go look at a lot of them before they call the health department, but no. But I see your points. It's valid points. Is that $125? I guess Kyle's presentation is that does open the door to get the health department in, and a lot of the homeowners don't realize it's going to cost them $3,000 or $4,000, or $5,000. But
Well, and I know, I mean, it's hard to put numbers on some of these things because we just don't see how much, but I know of situations where we go out to do a repair on a system that was already repaired illegally, where somebody's like, let's not get the county involved, they're just going to charge us money. and that kind of stuff, and we've heard those comments, and then we go back out there because the original repair didn't hold. I mean, it was, if we had permitted it, we wouldn't have permitted the way they did it, because it was obviously never going to work. Because that homeowner a lot of time, because they, and a lot of money, you got their rack repaired to begin with.
What happens if they get the permit for the repair, and you come out and say, well, the repair is going to take X, Y, and Z, and they had talked to someone that did the work and thought it was only going to cost X, and so now it's going to cost Y plus Z, and they don't have the funds for the Y plus Z. They can do the patch for the X, but they can't do the full repair for the YZ. So what repercussions do you have at that point to force them to do the complete repair?
Right. Well, the first thing I'll say is that one thing that we've always tried to do when we have funding issues is we do try to find sources within the county, and in some cases we've gone outside the county to find funding for low-income folks that just don't have the money to fix this house. There are some people that. The second side of that is if we feel that to fix their system requires the X, Y, Z, that will be required of them. We do try to work with people as best as possible on time frames, getting things fixed. But if it's a public health issue, we eventually have to, bring them into compliance. We issue, whenever there's a failure, we issue what's called a notice of violation. Generally, it gives them 30 days to get it fixed. If they don't get it fixed within the 30 days, we usually try to give them another 30 if it's not a public health issue. After that, sometimes we have to start, contacting, legal counsel on our side, to go ahead and enforce people to fix it. But we do try to consider.
So if all they can afford is a Band-Aid and they don't get a permit, they put a Band-Aid on, and they don't get caught. But if they come get a permit, they're forced to do more than just a Band-Aid.
Right, and we, on repairs, we get to actually break our own rules. We get to use what's called best professional judgment, which makes repairs kind of tricky, but it also gives us the freedom to assess, what that person actually can do and make the best decision on getting them fixed that they'll actually be able to do.
It seems to me that I would be more afraid of the bill that comes after the permit than I would be of the permit fee. I think that's the hurdle that would keep people from seeking your help. Not, oh my gosh, I don't want to go to the health department. They're gonna charge me a fee. It's more like, I don't want to go to the health department. They're gonna make me pay to fix it right, which is going to cost a ton.
Right. Well, I mean, I see people come through with all different mindsets. Your mindset, which would probably be closer to my mindset there, is, looking at the long-term cost of it. You see it both ways.
I'm not opposed to the change in fee structure. I'm just wanting to get a good bang for a buck.
And it is common practice in the county not to charge, certainly for repairs on septic systems. Their logic for doing that, justifying that, I don't know, but.
If we were to approve the fee, would they ask us to find the $10,000, or would the county give it to us?
They could ask us to find it. My suggestion would be to ask the county. I mean, we're asking for $142,000 or $152,000 less this year than we asked for last year.
It sounds like you've already found it.
But, well, that's, yeah.
I've heard the argument from other commissioners that, hey, environmental health and building inspections have to fund their programs. We can't subsidize them. Crap, that's what government is. We subsidize everything. We're dropping $2.5 million in the health department this year for a vast array of things. So why do we target environmental health to be a self-funded? It never would be self-funded.
I think because they're the largest expense of county money in the department. Over $500,000 goes to environmental health of that $250,000. The rest of it's spread throughout 20,
It's about
25 other programs.
Yeah, it's about 25% of our county, well, about 20% of our county ask, I guess, yeah.
I think that's why everyone picks on environmental health.
Does anybody want to make a motion that we either make those changes or eliminate these permit fees?
Sorry.
You're a dead man.
If we were to change it and it wasn't successful or it didn't bring results that we were looking for, how hard would it be to change it back?
Probably pretty hard.
So if we wrote this thing,
It's the political climate that you would, I mean, it's
it's a whole lot easier to drop a fee.
the public capital that you're bargaining with.
I think Kyle's in charge, and if Kyle thinks that that's what we should do, I think we should give it a go. I motion that we accept his little plan.
Do I have a second?
So what is this little plan to reduce?
Drop the fees.
Drop the fees for repairs?
And
No, for permits.
Wells and septic won't.
And,
Well, septics and abandonments. those are-
well, and Stu, that's one thing we didn't really talk about, but, we know that there's a $125 fee for those as well. And I know people who abandon it, so the wells without getting us involved in that as well. Because frankly, that's what those costs, and 125 is a significant portion of what they would be paid to do that.
$10,000 is what we looked for dentures this year, right? Above and beyond the 15,000 that we had originally?
I think we did five. Was it five? I think we asked for $5,000 more for dentures.
Oh, you're saying.
Just trying to put it in perspective.
These are fix my septic system, right?
Any more discussion? Do you want to?
Can we take a vote, who wants to do it, and who doesn't, and then we can motion after?
Well, I would say, because I got to vote on this thing 2 or 3 more times.
Well, you have more insight into why.
We can move on if there's no motion or a second.
I mean, if the county wants to pay for it, then the county can pay for it, but for them to ask us to fund it in our budget, I don't agree with that. But if-
Can we make a motion contingent on the county funding it? And
Yes,
if
you
they
can.
don't, then we stay.
You can do that, yes.
That's good. That's good motion.
I make that motion.
So the motion is to, I'm just trying to restate it, the motion is to approve the fees changes for private drinking water wells, on-site wastewater well repairs, well abandonments, with the stipulation that the county fund the change, that we don't have to find it elsewhere in our budget. Is that correct? So I want to make sure we get it right in the minutes.
That's her motion. Is there a second?
I second it.
All in favor?
Aye.
Any opposed? All in favor, raise your hand. Any opposed? Motion carries.
Make sure you get one all the same.
Thank you. We'll move forward with that change. Yeah, just this, Mr. Anders asked the question at the last Board of Health meeting about polling Board of Health members. And I did have a conversation with the county attorney, and he said polling Board of Health members is no different than polling boards of commissioners or any other board, as long as there's not a decision made based on the poll. And that we can do that. We can go ahead and do that.
The survey went out,
The strategic planning.
and we can't make, so just so I heard this right. The board can't make a decision based on the results of that survey. that
You
come back.
you can make a decision based on the results of that survey in an open meeting. You just can't make a decision based on that survey as a board unless it's in an open meeting. Because all you're doing is polling the board for information. Once you're in your open meeting, if you're gonna base a decision on the information gathered, it has to be in a public meeting. So that was Chester's take on that.
So you can't pull the board and use the information from the board to make a
No,
decision,
cannot
make
do
an
that.
administrative decision?
No, cannot do that. No. It has to be, if the board is polled for, if you poll the entire board for any issue, whatever, it has to go to an open meeting before it can be, a decision can be made on it. And that has to be a public open meeting when that decision is made.
Okay, so just sorry to beat the
So
horse
like,
here.
well, just like these environmental health fees, if I called everybody on the phone and said, what do you think? I couldn't then go and say I'm changing it based on that. We have to discuss it here in an open meeting in order to change it, correct?
Right, so now there's 70 or 80 people were polled, and so there can't be any
It's
use of that
only the
information.
board members. What do you mean?
Did you poll the whole department?
Yes. We surveyed the whole department, but the survey for the department is different than the survey for the board.
Okay.
The survey, the board is the board. That makes it a completely different,
So,
That's different from
so really that strategic plan survey, you really can't take much information, that the board filled out, you really can't take much information from it.
until we come back to the board with the
Can you
board's
bring-
information.
But you can bring
We
suggestions.
can bring we can bring the board's information back, and bring the staff's information back. Once we synthesize it all, and Kathy does her magic, she's not here to talk about it tonight. I know she's got, I don't know if she's got all of it, I don't know what she's got, without her, I'd have to have her answer that question. But once she puts all that information together, then if the decision is gonna be made on that strategic plan, on our objectives, then we come back to this board for that decision to be made,
With recommendations?
with recommendations from staff.
So
Oh,
you-
yeah.
the staff can make recommendations.
Yeah, what they put
Based on the
in
poll.
comes back to you guys, yeah. Plus the board's input into that. We're just trying to make it an easier process so it's not a 6-hour meeting. Because that's what strategic planning meetings with the boards have been. It's half-day work sessions, and we're trying to figure out a way to do that in a simpler format. So that we're bringing it back and we're saying, here's the things that were said, here's the things that we're recommending based on that input. And then you either approve or disapprove of the, to support the objectives of the strategic objectives and strategy.
I just want to be sure we're being as transparent as possible. that's
Yes,
all.
and I did talk to Chester. He said polling is fine. And it goes on all the time. It's what you do with that information that you glean from that poll. That, because it's a Board of Health issue, the Board of Health's input cannot be a part of the decision process unless the Board of Health is a part of that decision process and is voted on in a Board of Health meeting and in a public meeting.
Okay, I guess next most of you, I guess, are aware that Dr. Gillian resigned as chair, and we need to make nominations for chair at this meeting, and then we'll vote at the next meeting.
I did talk to the county attorney, and he said all that can occur in one meeting if you guys wanted to do that. But that's up to you. How you want to do it. So the floor is open for nominations for the chair position.
Hell no.
Dr. Peterson,
Hell no.
So there's some board seats, I think, that are up this year. Are all those people reapplying, or do we know, or?
We have polled the 3 members, well, 2 of the 3 members. Dr. Lenzo's term is up this year, and we will have to find another vet. Because
I promise
this
I won't
is
tell you my life.
he served all the maximum terms he can serve. He has to roll off the board a year before he can bring him back. No.
Is that true?
Yeah, he can be off the board a year and come back to the board, yeah. I don't have a paper.
Mine.
You're,
One minute.
who's, Emily's is up? Yours is up? Oh, you're filling the term of somebody else, that's why. And Emily has expressed interest in continuing. Paula, because she's retired from the school system, is, and her position was up, has opted to allow someone else to fill that position. And if it's the board's desire, we still continue to try and get somebody from the school system to do that. That was the board's desire in the past, was to have a school, somebody active in the school system on the board. So we try and encourage people within the school system, but it's, again, it's an application process, so whoever applies to the board and the commissioners make that decision for those public seats, but those are the only ones I think. Yours isn't coming up, but for some reason I keep thinking yours.
Well, mine would
You
have
just
come
got
up
rid of
as general public, I switched over.
Yeah, and but you filled the term of Sheila Price.
Yeah, but we came on at the same time.
Yeah, and that's one, yeah, so, and those are the ones that are going for June. So we have to take that back to the board in June, so we're gonna take back that
So Paula's
Emily's
out.
gonna continue.
For chairman.
Oh, is that what you're trying to get?
I just hate to do this and have to do it again in 3 months.
Yeah, I see what you're saying.
That was the only reason I asked. So Paul, you gonna do it?
Do what?
Chairman.
Oh.
Well, Nathan's not here.
Who volunteered to do it? You put your hands down now. Well, we just got some pieces of paper and I better on the name down.
You wanna do it, Teresa?
I'm only here if there's no one else.
So that would be a no.
How do you nominate? You do it either, I mean,
You can do it, that's why I suggested in the beginning to give it time, so that if people want to have a conversation between now and the next meeting, they can get a hold of me and we can get a ballot together by the next meeting. And vote on the nomination and vote on the person for that seat.
Well, Teresa, are you the only one, is Teresa the only one who's willing to do it?
Teresa's currently the vice chair, so.
I know what she is.
If Teresa,
We can elevate her.
if Teresa elevates to the chair, we'll be looking for a vice chair at the next meeting.
We tried to talk Molly into it last time, she backed out.
I'm sorry.
Didn't we try to talk you into it one time? Why'd you back out? No guts?
I think she's got plenty of guts.
A lot going on.
Are you interested?
I have to think about it.
How long?
You guys, everything longer than this meeting, I tell you that.
And, well, I thought Nathan was interested at some point too. I think like maybe 2 years ago when I first started, he said maybe.
You gotta start coming to meetings.
Yeah.
It's spring break, this is, every year is spring break, he's
Yeah,
there.
I don't like it.
That's his MO.
So Emily, you're coming back on.
You got a point, but yeah, she said she wants to serve again.
Baby, so
Yeah.
that's it. No other responsibilities.
And Paula?
I'm out.
Huh?
I'm out.
She's done, and they retired.
Can't go over.
Well, it just makes sense for somebody that's more involved. How long do you have to serve before you can be nominated?
1 year.
Were you interested?
Me? I'm having a baby. That's my excuse.
Gee, tell them that thing.
She's got to deliver.
I
so we're
gotta
out.
deliver the baby.
Well, since I'm leaving, I nominate Teresa, and then we could think about who might be willing to do vice, since Teresa has at least one meeting of presiding experience.
True, she has two, because he wasn't here one other time. I remember. She's an expert.
She does good.
All right, I'm in. Teresa, you're in. Okay, let's move
I'm
on.
staying, because I have to vote it again
Do you
too.
want to accept the nomination? I mean, that's the question I have to ask you.
Yes.
Think about it.
Are you going to think
All
about
I
it?
asked that she be available.
Were you guys think about doing it as well?
I could, but if Teresa wants to do it.
What'd you think about vice chair?
But if Teresa's going to do both, that's great.
You gonna pay back on next meeting? Just let Teresa serve, you will serve till next meeting, or you wanna, do we need advice?
I can serve till next meeting if I.
Yeah, oh, well, you gotta serve the next meeting.
Serve as interim, or you're vice chair, yeah.
She's vice chair.
How long can the vice chair serve?
There's nothing in the bylaws that really, yeah.
Indefinitely.
So could she serve for the 3 months and then,
Well, it won't
3
make a
months.
difference
well,
because
it's 3 months
there's
before we have
only
to.
4 of us that are eligible.
Yeah.
4 of us that are eligible to do it. So it won't make a difference at 3 months, right? Because the 3 new people coming on can't do it. So,
Think about it, give me a call so we can put together a list if that's what you wanna do.
Is that agreeable to everybody? If you're interested, contact Jim and he'll put a list together for the next meeting and we'll have her vote. I need a motion that we move into closed session.
A motion we move into the closed session.
Second.
Second.
Do you have to state the reason why, Jim?
It's a personnel matter, and you have to state the motion the next day. I'm sorry, I can't tell you that.
It's okay. Just trying to stay transparent.
Before you do your vote.
So our motion is that we move into closed session
There's no, yeah,
and that Jim will
specific
relay.
action.
this is, no action's gonna be taken.
So you're still making that motion?
Yeah, thank you.
Is there a second?